Hey everybody, Mark Beckstead here with the second edition of Perio Perspectives. Last week we talked about monitoring peri-implant health with probing, charting, and radiographs. Today I'd like to talk about periodontal maintenance, how to maintain peri-implant health. First of all, I'd like to point out that over the years, implants have changed both in design and in materials. Much of the literature that gives us guidelines as how to maintain the implants was based on older models. Originally, we used external hex implants that were bone level, but the abutment attached at the implant surface and had a collar that extended through the tissue, something called a multi-unit abutment. That produced restorations that looked something like this, where the polished collar was exposed underneath the restoration. Some of you probably have restorations like this in your practice. The concern with maintaining these, particularly with metal scalers, was the risk of scratching the polished abutment, thereby allowing for plaque accumulation. As time has gone on, implant design has changed. We normally use bone level fixtures, which have an internal connection and even a platform switch. The abutments that go on the bone level implants tend to be something like this, a Perio base abutment. Both the bone level fixture and the Perio base abutment are made of titanium and zirconium, a mix which is harder than the original titanium implants and more resistant to scratching with metal scalers. In addition, in the anterior part of the mouth, it's not uncommon to use zirconium abutments. And in a restoration like this, I would not change at all the way that I maintain this restoration compared to natural teeth. I would use metal scalers, metal probes, and home care instructions to the patient as I would for any other restoration in the mouth. With regards to scalers, there's many available. Plastic scalers have been used for years. There's carbon scalers, there's titanium scalers, and steel scalers. The move has been towards using metal scalers. The design and the materials of the implants are more resistant to scratching, and I prefer the ability to get under the tissue with a metal scaler, so I would suggest that for your consideration. The other thing I'd like to mention, and I'll do a short demo, is I'm sure all of you are good at teaching patients how to brush, but when it comes to flossing around implants, I like to teach them to wrap the floss under the gum and around the neck of the abutment. Most patients don't go deep enough with this wrapping, both from the mesial and the distal. I'll show you a picture here of, here's an image, clinical image with floss wrapped underneath the gum line around the neck of the implant. And it almost looks like the floss is extending from the center of the tooth when it's in the right position. Radiographically, and it's helpful to show patients this, we want that floss to go up into this crevice around the polished collar of this tissue level implant, both on the mesial and on the distal. In addition, the normal things that we would use to help our patients with home care, such as Proxa brushes, rubber tips, and water pick, are very helpful in helping to maintain implant restorations. For hybrid restorations and bridge restorations, I like the water pick. We can talk more about the irrigants that are used in the water pick, but irrigation is a helpful tool. I'd also like to invite you and your hygienist to join the Palo Alto Study Club in February for a more in-depth look at maintaining dental implants. Please call Tina, my coordinator, at our office number to find out more details and to sign up for that meeting in February. Thanks for your attention. Look forward to talking to you next week. Bye now.